Hey, everybody. I'll get to the right screen. We're clicking on all kinds of buttons today, guys. And some of the buttons that we're clicking on, folks might not even know they're ones that we click on, and that's medical trauma. So sometimes our patients go through something that they didn't realize was going to be a traumatic PTSD, potentially inducing problem. And Lauren, Marina, and I just wanted to jump into that real quickly to give you some ideas of what it is, how to deal with it, and how to potentially prevent it in some of your patients kind of moving forward. So we'll jump right into that right after this. It's funny. There's always a segue, I guess, in life, but I have so many screens flashing up. Like I just opened a couple of things, audience, for you guys to all see that Marina and Lauren have sent over my way. And honestly, it's distracting, like in general, and just tough to find what we really need. And I think that segues so nicely into medical trauma. Like we are in a vulnerable spot, like we're right about to go into an issue that we're not sure about, or a family member is going through a problem, or we've just gotten a new diagnosis. We don't know what the diagnosis is. We just have symptoms and we're worried. And we go into a care setting and put our trust or faith potentially into people we don't know. And then sometimes things just don't turn out the way we want them to. And what ends up happening after that can, to a certain degree, scar us for a very long period of time, kind of moving forward. But wanted to send it over. Kevin, Lauren, and Marina, all here with you today on the Functional Medicine and Herbalism show, talking about medical trauma. So if you guys have experienced it, comment, please interact with us on the show, any questions that you might have. And I'm going to turn it over to Marina first to kind of describe medical trauma and to go into some of the nuances.
Yeah, well, I first want to share that I definitely have been on the receiving end of medical trauma, and having the healthcare background that I do, a professional pharmacist, sort of caused me to doubt, the field that I went into and how I'm being approached and how care is provided to me. And I came to the realization is that it's all about managing expectations, and that we are always practicing medicine, right? It is a practice, nothing is set in stone. And there's sort of like sometimes this hero savior dynamic that, people depend on healthcare, and maybe there's just unrealistic expectations from the get-go that are involved, but also there's, this responsibility dynamic too between where does it end with the patient's self-care, right, and responsibility and prevention and all of that, and then where does the responsibility of the provider begin? And so I do think it's complex, and the complexity stems from the societal perspective and the historic perspective of how healthcare has evolved, politically in different regions. And, here in America, I think we can all agree we have some of the best training when it comes to modern medical systems. And that's why everybody from all over the world sees our practice as the gold standard of care, and people who can afford it or who have health insurance benefit from the system. However, medical trauma is when the expectation of the patient is not met, right, when it comes to healing, and when the patient is exposed to something they're not ready for, right? That's really the definition of trauma, is when your body or your nervous system undergoes some sort of stimulus or some sort of action that the body was not ready for, it was not prepared to receive or to go through that experience yet. It was, just premature, right? And the managing expectations of peace, maybe the education, the prep, the true informed consent was not there. The foundation for that was not set up. So the body is not ready to receive this type of care, even though, the physician prescribed it, and we have signed the forms and all of that. There's a disconnect between being truly ready and also being truly informed of all the risks and benefits. And then the outcome, right? There's a lot of expectations to what the outcome of this procedure or treatment will be. And that is just not addressed. So there's no continuum of care sometimes either. So it has to be that every stage of the treatment and care process is very informed, very intentional. And again, like you said, Kevin, that trust, right? So if there is this piece that's not happening with building trust and maintaining trust, it's very, very easy to break that trust. And then the body stores onto that emotion that was created and makes a meaning out of it. And then it becomes a trigger point for any other experience that you go through in life that imitates a similar feeling of vulnerability. You're just going to get triggered, and then you're going to have complex repercussions and triggering of the same button. And this goes back to nervous system regulation. And this is how complex and post traumatic stress, and disorders also start to compile. So it could be just one initial trigger, but then it just gets stored and doesn't get processed out of the body. And it just keeps on having you stuck in a sympathetic overdrive and fear response and not being able to heal, which further complicates healing. And if I could just add one more thing to my long rant so far, in the context of also all the political charge, right? And the climate that we're now living in, where, post COVID, we had one thing after the other with so many things, that we have to deal with, as a country, as, different political parties or, um, you know, systems are coming into question, and then wars in different zones. I mean, yes, count our blessings that we're not in an active zone, like personally, but, even if we're not aware and it's not brought into our attention, there's so much bad stuff happening all around us all the time, and then bringing it to our awareness can also cause a lot of trauma and also feeling helpless again, and managing those expectations when it comes to dealing with not only the internal world, but the external world.
I love that you added that, Marina, because I don't think we've ever experienced before, at least I can't remember, Lauren, experiencing since being a young boy, that exterior pressure of what the medical world is going through or any conflict within the medical world. It usually seemed like it was a fairly united message that was coming across. And now we have those other conflicting issues kind of to deal with. So, Lauren, the one thing I wanted to ask you about a little bit deeper with medical trauma in general is, I know you have your own story that you've shared before about you going through a medical journey and kind of the trust and questioning that may have happened along the way. But for me, like medical trauma in general, when I think of when I didn't have anything close to trauma, when it was relieving high levels of trust, like if I was sick as a young boy and I went to grandma's house, there was nothing but just love, right? I felt cared for. I felt taken care of. I felt at peace. And I feel like there's a real disconnect between grandma's house and the sterile environment that we create inside of the medical world, where I've got 7 minutes to take care of you. I don't have enough time to talk to you. Where do we go, do you feel, Lauren, on these next kind of steps in our journey, and kind of compare it to your journey of where you went, to make sure medical trauma isn't so abrupt?
Yeah, I think, for a lot of people, the reason they get into functional medicine is, whether they know it or not, related to medical trauma, because at some point something just hasn't worked, or they felt dismissed, or they've been gaslit and told that their IBS symptoms aren't real and that it's just all in their head, or, whatever the case may be, or that they've had adverse outcomes from the medical system and end up, on multiple medications and not feeling any better. And certainly it's played a huge role in my own life, especially around being a caregiver for my mom. And, I think some of the graphics and things that we were showing is sort of how it extends beyond just the patient, but then also even to, the medical staff and the environment, all of those things. I would even add the caregivers in there too, right? It's like they're also involved in so much of that. And it can be really traumatic for them as well, trying to care for a loved one who is going through such a terrible time with their health. So I think that, there's certainly a lot of ways that we can create better healthcare through things like herbalism and functional medicine, and getting back to, like you said, even the way that grandma would help, right? Just these more natural and more comforting ways to heal, because ultimately, whenever the body is in that state of stress, it can't heal. It impairs the ability for the body to heal. And so certainly hospital systems, health systems, and prescriptions and all of these things have a place, but the delivery of it is almost impeding their ability to work effectively. So, I think there's so many things that we can add in, and I think that's really where having complementary modalities and a truly integrative approach is so important, because we have to be able to meet the patients where they are and be okay with what's working for them, and how can we support that and integrate it in and have this holistic approach that we're saying, okay, yes, we maybe are having a severe infection and we need to be on antibiotics for something, or we need to be hospitalized, but like, would it hurt to also bring in someone's energy healer if they feel that helps, right? Like they've done some studies back in the day of saying, like, yes, you can add Reiki into a healthcare system, right? And is it going to necessarily be like the thing that moves the needle in terms of like treating or curing a disease or a condition? Maybe not necessarily, but is it something that's going to help improve the outcomes and help the body be able to heal? Absolutely. So I think it's just being able to really empower patients to ask for what they need and not judge them for it, not scoff at it, right? I think there's just a lot of judgment, unfortunately, that happens within traditional healthcare systems. And that's part of what really contributes to a lot of the trauma.
Yeah, it's so interesting you talk about some of the trauma being related to like allowing the patient to have some of their own choice involved, some of their own healing modalities involved. And we look back in history and we see black bag medicine, right? Individuals going to patients' homes, or we look at other cultures and they're going inside of patients' locations so that they feel comfortable. There's lots of like famous physicians that they actually prescribed an individual to have a puppy lay on them or a young child to lay next to them. And Marina even commented about the kiss the boo-boo approach and showing that, hey, that actually does help. Some things in children like pain management in kids, a little bit of sugar or honey can go a really long way. So there's so many of those things, Marina, that I'm really curious on your thoughts on how do we make, like with the medical trauma that occurs and after it has occurred, because let's face it, like we can't go backwards with everybody. It's already happened, for lots of individuals. If we have individuals listening to us, or we have healthcare practitioners listening to us right now, that they have patients they know have gone through medical trauma, the trust has dropped significantly. Their connection with the medical world has dropped significantly. How can we reestablish some of that? Like, what are some of the first steps that make sense for us to do to regain our patients back to recognizing we're here to help?
Yeah, I think it's so easy to just throw the baby out with the bathwater, right? And just say, okay, well, this happened to me. And then you just are going to assume that it's going to happen perpetually, right? And then you want to protect yourself. So you decide to distrust every facet that had to deal with that negative experience. And so I think that is your body trying to protect you, right? And it is like a normal response to protect you from further aggravation and trauma and pain. However, there are, again, like I said, beneficial aspects. Like, we're all trying to do the right things. The problem is when it's so deeply rooted, it's a systemic issue, right? We can't just we can, right? As individuals, do something about it and empower our own patients and build the practices that we would like.
Yeah.
But, for optimal effect, which is what I always talk about with herbal medicine and traditional medicine and, my holistic approach, a true holistic approach looks at the whole entire system. So yes, we can approach each individual, which is what functional medicine is really great at, right? And help each one and really uncover all of that and get to the individual root cause. But when I see systemically, we have to have a whole re-education of our whole system, and also looking at each part of the care model, right? As we talked about, like, what is the patient experience? What's the patient journey, right? And if we look at healthcare as a business, which it kind of is, right? What is that client journey, right? What does that look like? And why don't we try to actually build one that serves the client and not just for the convenience or for the efficiency that we've now come as like an industrialized assembly line approach to healthcare, right? So what you mentioned before about how can we make it so that on the whole, everybody actually feels supported. And to me, that starts actually with looking at the system, but then also breaking it down to little ecosystems that can then have interconnectedness and interplay and reciprocity, right? Even that chart had that reciprocity. And we can't do that on large scale assembly line systems. And I also don't think we can do it in one-on-one settings. I think it needs to be interdependent, smaller chunks and communities.
I love that. I read a recent article that was really breaking it down this way, Lauren. It was looking at value-based care, especially in managed, like in Medicare Advantage plans, right? And saying if you're going to use a care coordination model, then you can't have disjointed care coordination. Like, hey, we're going to help with this, and we're going to help with this, and we're going to help with this, and this is one pathway, and here's another. Because then patients get just pulled around, and the entire system is disjointed. Which, I mean, let's be honest, that's what it is. I mean, that's what it is today. And I think with that disjointedness, you feel like you have taken away or you have disempowered individuals, like patients as a whole. But I think that's one thing that the three of us all know is that we're not going to change the system tomorrow, right? It's not going to all of a sudden become something that is more holistic, more in touch with each individual, allow for more time and expansion. So my question, Lauren, is really, how do you prep patients or help patients when they're going to go back into the medical system so they can be more successful? Like, what can their mindset changes be? What can they do to get themselves in the right frame of mind? What kind of allies can they bring with them to be able to help? I'd love to hear your thoughts on that.
Yeah, I wish there was an easy answer for that one. I think there's, so much. A lot of it comes from just being prepared as much as possible, having questions ready to go, having sort of an outline of the things that you are willing to do or not willing to do, being able to kind of stand your ground, even when that can be hard. I know there's a lot of individuals, now who are also getting into being medical advocates. And so that might also be something else that would be worth looking into is, do you need someone that can be there as an advocate for you, and actually bringing in that person to help with negotiating and navigating throughout the healthcare system as well.
I love that. Yeah, I think that sometimes internally, like, we can break enough things down and try to prep ourselves and try to get over all of these things, Marina, that I wanted you to tell us about before closing out the show. But having someone exterior, if it is a family member or a professional advocate, is always so impactful. But Marina, when it comes to impact, like, these can be some of the stresses that you wanted to kind of address related to what happens to our body with trauma. Can you please tell us a little bit about these individual pieces and then close out the show for us?
Yeah, absolutely. So as I related, a lot of it has to do with our nervous system regulation and how we respond to things that the body perceives as stress, whether or not we realize it. And again, it could be so subconscious that you're not even aware that some of your chronic conditions, just as shown as on this chart, that, for example, functional medicine, right, deals a lot with getting to the root cause of these conditions that we see all the time. And people are on a lot of immunosuppressant or biologic medications with specialty pharmacies, or pain and inflammation. These are like at the root cause of a lot of chronic conditions, right, that people have, and that they're using pharmacy services and other sort of allopathic services, including surgeries, and all of these like escalation approaches, or even things like diabetes, right, that is just rampant, or obesity, right? Why you even have those conditions and that level of inflammation, a lot of the times it's because of your nervous system regulation and because of your trauma responses, whether it's, addiction to certain substances, whether it's illicit or, sold to us in stores as food, but is actually a toxin. there's a complex interplay, between what we're exposed to physiologically and also how our body interprets things into biochemical signals, which could very well deal with your emotional and stress and your trauma that you've been through. So these things are all interconnected. And I think, as I said in the chat, it starts with just the awareness that these are relevant to healthcare. It's not just the labs. It's like, why is my body responding this specific way? And it's complex. And one of the things is emotional nervous system regulation and trauma responses. And so we need to start looking at that in all of our institutions and start teaching it in schools when people are learning to be healthcare professionals.
I love that. Well, thank you both for your time and insights on this. Hope everybody enjoyed it. Thank you all for listening. If you have any questions, hit us up, and we will see you guys next week for another exciting episode. Have a great day.
Bye-bye.